I think that when we're talking about access and we're talking about it for specific populations, we have to do it in the framing and the understanding that access is not equitable to begin with. So, number one, there's a system level barrier in regards to who's able to receive the services. So when we're understanding why we're seeing inequities in regards to certain geographic locations, we're talking about things like being in a non-Medicaid expansion state, having poor public transit opportunities available to you where you live, being impoverished, being a victim of systemic racism. Those are all barriers that communities of color face a lot of times on a day-to-day basis that make access difficult. But when we're talking about specifically how do we improve messaging and understanding around PrEP and HIV testing and prevention, I think that we have to do it from a framework where we're not talking about risk, but we're talking about health.
One of the things, really kind of going along with what we just heard, Black women, regardless as to how you got to your Black woman, how you got to your womanhood, we often put others' needs ahead of ours. We trust people, perhaps, who don't deserve our trust, and yet we're distrustful of medical systems. And so one of the programs I'm involved with is changing risk to reasons, where we're actually helping Black women to reframe what risk is in terms of reasons. When we think about risk for HIV, we really are putting the responsibility, the power in someone else's hands. Sex for me as a Black woman is risky because my partner may have HIV, versus when we reframe our thinking, when we collectively reframe as Black women and think, well, you know what, my reason for protecting myself against HIV is because I don't want to have to take this medicine for the rest of my life, or I have children, or I want to be healthier. We can speak from an empowerment standpoint and are stronger and better and can make healthier decisions when we speak from an empowerment standpoint.
We do need a lot of policy changes that is on the larger societal level, as well as in our healthcare facilities and how they are engaging in care with people, centering the patients, which we don't do, in all honesty, in our healthcare settings. And we have honestly have separated how we look at sexual health from overall primary care. And that in itself has created a barrier to women of all experiences engaging in healthcare. And because we are not training our providers to provide gender affirmative care, we're not training them in cultural humility and competency, and that creates barriers for people when they and encourages, I feel like, or increases the medical mistrust. Because why would you want to engage in a system that constantly disrespects you and doesn't see you as a full person? So when I think about what needs to change, it's on so many different levels. So it's not just about if you're having sex, but who you having sex with, what type of sex you're having, are you engaging, what kind of practices you're engaging in, what are your plans? And so these are things that are inclusive of it. Women are coming in and they are maybe presenting with like a STI, and no one's talking to them beyond that. They're treating the STI, but they're not talking to them about other options of what they can do. Like maybe PrEP is an option for them. Maybe PEP is an option, and giving them those choices and giving them the right, accurate information of what that may entail. One of the challenges that I think we had is that a lot of women did not understand or know that this was something that they could take, because no one spoke to them. Like the messaging in our communities was missing them, basically. If you are directing it to one population, then that's who people are going to associate it with. And they're not going to really associate it with everyone who could be who's sexually active, because that's basically who it's for. but that's how we have the tendency to frame things. And I think that's been a detriment to looking at HIV prevention, because we're not focused on sexual wellness, and that's the whole person. And if you look at the WHO's definition of sexual health, that includes physical, emotional, mental.
So if you have someone coming in for routine sexual health care, if you have someone coming into their family doctor, if you have someone coming into their pediatrician, because really you should be talking about sexual health in adolescence, then technically at that point in time, you should be teaching things like autonomy, what it means to have a healthy sexual relationship. Because I think that if you have a healthy sexual relationship, a lot of times that's a reflection of your relationships in other forms throughout the rest of your life. And PrEP is a part of that. So anytime you start engaging in sexual activities, you should be educating people about PrEP as a part of that toolkit. So these conversations actually should be happening regardless of your gender identity, regardless of your race, your ethnicity, and your background.